Hello and good morning everyone, and welcome back to my channel Radiology tutorial. In this video we will discuss about the humerus bone and just go through the anatomical structure of humerus bone. Basically humerus is the largest and the longest bone of the upper limb, and it having two ends, which is epiphyseal and diaphyseal end. It articulate proximally with the scapula and distally with the two elbow bones, which are radius and ulna. First we will talk about the upper end, as the head of the humerus is in hemispherical shape, which articulate with the glenoid cavity of scapula and form the shoulder joint. This is the glenoid cavity of a scapula, okay, and this joint is also known as glenohumeral joint. Now we will talk about the anatomical neck of the humerus. It is situated in the periphery of the head, okay. Greater tubercles are the projected lateral below the anatomical neck. Lesser tubercles in the front upper end, also situated below the anatomical neck. Intertubercle grooves lies between the greater and lesser tubercles surgical neck. The common site of a fracture of humerus, it is the point below the two tubercles. Now we will talk about the shaft of the humerus. Basically, the shaft of the humerus provide the surface for the attachment of the muscles. Now we will talk about deltoid tuberosity. It is an outer aspect of the shaft where the deltoid muscles are inserted. Radial groove, it is also known as spiral groove, through which the radial nerves are passes. Now we will talk about the lower end of humerus. Basically, the lower end of humerus consists of lateral and medial epicondyles. The lateral and medial condyles give the attachment to the muscles of forearms. Capitium. The capitium provides the surface for the articulation with the head of radius. Trochlea. It is a pulley-shaped projection that articulate with ulna. Cornoid fossa lies interior and superior capitium and trochlea. And now we'll talk about the olecranon fossa lies posterior and superior to the trochlea, where the olecranon process of the ulna attached. Okay, that's it for today's video. Hope आपको वीडियो इंटरेस्टिंग लगी हो, एंड अगर आपको वीडियो अच्छी लगी हो प्लीज़ लाइक एंड शेयर एंड सब्सक्राइब माई चैनल फॉर मोर वीडियोज़.